Hi everybody, and welcome to the Weekend Warrior. Today we are opening a can of worms called soy. What is the deal with soy, and should we be feeding it to our children? All right, where do we begin? Man, there's so much controversy between the thyroid, the estrogen, so kids turning more feminine, between breast cancer. All right, let's start with babies. What does the research show? Well, in babies, there's not a ton of research. What I find is a lot of case studies and small clinical research trials. And this is what's showing up. In children who are born with congenital hypothyroidism and are taking levothyroxine, which is a thyroid medicine, soy is contraindicated because in numerous small studies and case presentations, it showed that the soy formula was interfering with the medication, causing the children to become more hypothyroid. Issues in babies. When babies have a milk protein intolerance, which is a lot of babies I see these days, there's a 25% chance that they're soy intolerant. So no soy in those guys. If the child has severe eczema and other dairy-related issues, soy is not indicated in those kids as well. There was a very small study in the journal Pediatrics in 2008 that showed that in kids that did not have autoimmune conditions compared to kids with autoimmune conditions, that when they drank soy formula, they're higher risk of developing autoimmune conditions. Very small study. So what is the moral of the story? For those reasons, and I do think there's still a lot of unknowns. And again, in the literature, there is just not a lot of long-term data in babies on American-based soy formulas. So at this time, I'm not recommending those in babies. For recommendations, please check out my YouTube video, which I'll link here, that I talk about how to feed your baby. Now, in older children over the age of 1 that are healthy, they don't have any chronic medical issues. With any child that has a chronic medical issue, please speak with your provider and don't take just information from Instagram. I know this is amazing information, but this needs to be personalized to you and your family. This is not specifically to you because there's so many nuances to each human. Anyway, moving on. For babies over the age of 1 who are super healthy, and should we give them soy milk? Here's where I've changed my tune. I used to be like, no way. But I'm gonna change my mind, and a lot of people are gonna be shocked by this, but it is okay to do soy milk in older kids over the age of 1 when the soy milk has 2 ingredients, water and organic soybeans. That's it. No additives, nothing else. Why did I change my tune? Well, because I looked at a lot of research and did a lot of thinking, and I've done a lot of label reading, and it is so hard to find milk for children that is good protein, fat ratio, and also good calcium, right? So soy does tick those boxes, but it has to be organic, has to be only 2 ingredients, no exceptions. Why? Soy is one of the most polluted GMO hybridized crops in the United States. And that is part of the issue. It is full of glyphosates and all kinds of herbicides and chemicals, and it is imperative, no exceptions ever. It has to be organic and non-GMO. The other thing is so many of the milks have all these additives, and if you refer back to my dairy part 2, where I went to the store and turned all these non-dairy milks around, and they're just so full of additives, nobody got time for this. So because everybody wants to know what is the one answer to my medical problem. There is not one answer. It's 1,000 answers. And because you can't get food anymore, now you get food that has been processed to death, and then we're like, oh, soy is the problem. We're like, no, it's soy that has been processed to death, and it's GMO, and it's sprayed with herbicides, and then when it gets put in a box, it has all these additives to it. So it's really hard to tell what the heck is the problem. The literature coming out on breast cancer is coming out of Asia, which is showing that women of Asian descent who live in Asia are eating soy from Asia and have lower rates of breast cancer than American women or Asian American women. Why is that? Because the soy in Asia is very different than the soy in the United States. Now, in Asia, they have lower rates of breast cancer in women who are eating soy starting from adolescence. However, when those same women move to the United States, their rates of breast cancer increase and rise to the levels that we see in the United States. Why? Because now they're eating the soy from the States. If you already have breast cancer or high risk of breast cancer in your family, it is really important to speak with your provider regarding this, because this, depending on what kind of genetic makeup, receptors, and all that stuff, you need to speak with your integrative oncologist about soy and breast cancer. For thyroid issues, if you have thyroid issues and are on thyroid medication, it is best to not have soy at the same time you're taking your thyroid medications. And one of the things that a lot of literature says over and over again, women who have issues with thyroid disease and have changes in their thyroid hormone after eating soy is because they're iodine deficient. So it is really important to look at your diet, especially if you no longer use iodized salt, which I recommend you don't use iodized salt, but taking that out of the diet means you don't have enough iodine. Iodine comes from the earth and from the sea and from the food we eat. So you need to have iodine in your diet. Previous post way back when on that. Moving on with soy. You know, people may look at the post and go, oh, she said soy is a go. Let's do this. Okay. Whoa. No soy lecithin. Then there's like the soy isolate. Then there's soy concentrate. And then these are all processed soy. So the moral of the story is, I am okay with soy as long as it is organic. It is simple ingredients. I am not doing soy isolate. I don't even do soy concentrate because these are all processed soys. Soy lecithin is a problem because I like chocolate, but I've recently really cut back on chocolate because chocolate is full of soy lecithin, and that we don't really want in our diet. So those are the things. So what we're talking about, should your child drink soy milk sometimes? Okay, make sure you vary the milks. If the child has 32 ounces of soy milk daily, we're gonna have a problem, just like if your child has 32 ounces of almond milk daily. So rotation is the key, as I say over and over again, but feel free to introduce a clean soy product into your child's diet for additional calcium and protein. As far as tempeh and tofu, again, what is it made out of? It is simple ingredients that you read and you don't have to look up. Go for it. Organic, non-GMO. I hope this helps. If you have questions, shoot them over, and I may have to additional videos depending on what you guys are asking. Thanks so much. Have a wonderful Sunday.